so let's run through this scenario. Small dental arch, small pelvic arch. Oftentimes it's like a matching set due to the forces and the story of one letting us know what happened at the other arch. So let's talk about three important things here. First thing being jaw development. There's a few things when it comes to jaw early on that are huge. The more chewing, the longer someone breastfeeds, the more action we get up here, we ensure the fact that our engine and the pipes, which is our nostrils, literally get maxed out to where breathing doesn't become an issue at some point to where we can't move air fast enough to match the engine being the body. And then as a result, the tongue comes down, so we have to mouth breathe. This can happen in sleep, during the day, but the more we're getting the right nutrients, breastfeeding longer, and essentially getting a lot of chewing early on, we max out the development early on in the jaw, which allows us to have as big an engine as possible, okay? Now, with that comes a proof, like in math, tongue sits on the palate. I can keep all my forces centered through the midline because I can create centered head. Basically, my cranium center of mass sits through the middle of my arches. The minute my tongue can't sit up on my palate, I've lost the loft effect to my head. And then this is where we play kind of human Jenga here, where now all of a sudden the center of mass, which should here, literally is going to shift forward. And what ends up happening is, imagine basically for me, here's my pelvic outlet, here's my ribs. If I'm supposed to get this pump effect where it sits through the middle of my body, well, if someone comes through and cuts kind of basically like the corset that kind of keeps these two, instead of my body getting this, I tend to get like this. So I no longer get all the forces down through my arches. It's kind of like this jaded vectors of force, which no longer puts it through the ground the way it would have if the tongue set up on my palate. So that leads us to the third factor is, I need the tongue on the roof of the mouth so that one, I have a chance at having good posture, because the posture in this is going to allow me to have the chance to load through my arch, therefore get enough force through my pelvic outlet as I'm developing that I can get some width to it due to the forces I put on it. Then there becomes this whole, okay, now I have the opportunity, I have to train it. And part of that comes down to, if my tongue never comes down when I'm developing, then not only how I basically subconsciously posture myself, the way I do most things in life, I have a different force vector as far as how I'm loading. But essentially, when I've got this optimal pistoning of the ribs and pelvis, I can drive forces down. I almost think like waves, like a bubble gun, and the floor pushes back up into me. So this is where, you know, the three factors matter. The biggest thing being the jaw. The stronger and wider the dental arch is, it's like a magnifying power to the force, because I can create more force. I've got a better seal. I can create more everything because my engine is bigger. So instead of like a V8 and I nasal breathe, I can have a V12 and nasal breathe. That changes the magnifying power of the forces I put into the ground with good posture. And this is where it all comes together and matters.